Hello everyone, my name is Rajan Bola and I am presenting an abstract on behalf of the Canadian Network for International Surgery titled Clinical Validation of the Community Maternal Danger Score. Maternal mortality and morbidity in low and middle income countries is often associated with the lack of skilled birth attendants during childbirth. There do exist niche risk analysis tools for the purposes of preventing maternal mortality and morbidity. However, these tools often target specific indicators of risk. To the best of our knowledge, there exist no broad-based risk scoring tools that have been validated in the literature for the purposes of preventing maternal mortality and morbidity in low-resource settings. The Community Maternal Danger Score is a maternal risk analysis tool that was developed from evidence-based research. The study objective was to validate the CMDS on a cohort of pregnant women who delivered at a tertiary hospital in Makurdi, Benue State, Nigeria. We first conducted a literature review to identify risk factors that are associated with the need for a skilled birth attendant. We then examined medical records of women who delivered at the Federal Medical Center in Makurdi, Nigeria. Outcomes associated with the need for a skilled birth attendant were recorded, including cesarean section, postpartum hemorrhage, sepsis, and eclampsia. We used logistic regression and receiver operator curve analysis to validate the CMDS and quantify its discriminative capabilities. From the literature, we identified 7 risk factors that are associated with the need for a skilled birth attendant at delivery. These are age, being younger or older, parity, being nulliparous or grand multiparous, BMI, being underweight or overweight, fetal size, having a small or large fundal height, as well as having an adverse obstetrical history, having signs of preeclampsia, and having any coexisting medical conditions. 589 women were included in this study, 67% of whom required a skilled birth attendant, as can be seen in Table 1. Signs of preeclampsia, obstetrical history, and coexisting conditions were highly associated with the need for a skilled birth attendant, as can be seen in Table 2. Altogether, the CMDS had an area under the curve of 0.73. with a 95% confidence interval of 0.68 to 0.76. This suggests moderate discrimination in clinical settings. Altogether, the CMDS is a low-cost, evidence-based tool that uses 7 risk factors validated in Makurdi. The primary strength of the CMDS is its simplicity and flexibility within low-resource settings. Non-specialist healthcare workers can use the CMDS to encourage pregnant women to seek a skilled birth attendant in preparation for delivery. The CMDS may also help strengthen care in areas with high rates of maternal mortality and morbidity where it is implemented. Altogether, we recommend that future research pilot the CMDS prospectively in a community setting to better understand its impact in regions that have high rates of maternal mortality and morbidity. Thank you.